Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. Today's show topic is brain function, Alzheimer's disease, and the role of chronic inflammatory response syndrome, or CIRS. I just got finished interviewing Jill Carnahan. She is board certified in family medicine, integrative holistic medicine. She's a functional medicine expert and physician who specializes in the treatment of chronic inflammatory response syndrome, which is the body's way of responding to a chronic toxicity. In this case, we're going to talk about mold, resulting in a cascade of inflammatory biomediators in the body and/or hormonal changes that can result in chronic fatigue, chronic pain syndromes, chronic gastrointestinal complaints, chronic sleep disorders, chronic hormonal imbalances, and in some cases, significant cognitive decline or alteration. And that's really what this talk is about. I've been studying the work of Dr. Dale Bredesen, a neurologist from UCLA and the Buck Institute for Research on Aging, has shown you can reverse early Alzheimer's disease. And there's three main types of Alzheimer's disease, but one of them, he calls inhalation Alzheimer's, has a toxic component, and mold tends to be a significant portion of that. So I interviewed Dr. Carnahan because she's an expert on mold and this chronic inflammatory response syndrome, and she's come about noticing that it affects cognitive health and neurologic decline from another avenue, from the just mold sensitivity. So I interviewed her because, number one, she has some personal experience with this. Not only is she an expert, but in the age of 25, when in the medical school, she had breast cancer that was treated with chemo and radiation therapy. Then she got Crohn's disease. That was treated appropriately. And then for the next 10 or 15 years, she practiced functional nutritional medicine and kept herself very healthy. She was working in an office and being very physically active and good vitality. And then all of a sudden, she noticed she was getting short of breath, numbness in the legs, weakness, bloodshot eyes, just frequent infections. And she kind of lived in a little bit of denial that it could be related to mold and this chronic inflammatory response syndrome. But then eventually she tested her office and found out that there was tremendous amount of Stachybotrys in the basement. And so she sold everything, got out of the office, and her health started to turn around. And it turned out that there was also, in addition to that, some flooding in that area, which kind of catapulted why she might have manifested those symptoms at the time that she did. So that sent her on a journey. Number one, to treat herself or learn how to treat herself for mold illness. And in that process, she became well, and she also learned about this chronic inflammatory response syndrome and the ways to approach it. And she also learned in that journey that it could affect cognitive decline. So the approach in chronic inflammatory response syndrome goes something like this. There's about 24% of the population have the genetic susceptibility that they can't detoxify mold toxins well. So they're very susceptible to water-damaged buildings. And this can set off a cascade of inflammatory and hormonal changes that can result in chronic pain, chronic gastrointestinal disorders, chronic fatigue syndrome, chronic sleep disorders, neurologic decline, because these inflammatory mediators can cause other hormonal imbalances that cause all kinds of havoc in the body. When you treat this cascade of events and normalize it, many of those symptoms improve, but the one we're really interested in was cognitive decline. And she noticed it improved in her patients before she even started thinking about the Alzheimer's connection. And then Dr. Bredesen came from the other end of finding out that, he had a system that could help reverse early Alzheimer's, but there were some that just were very difficult, and they fit this pattern of being exposed to a toxin, i.e. mold. So how do you approach this? Well, first of all, you take a good medical history, and many of these people have mold exposure, water damaged buildings. And if you are suspicious, There is number one, a group of tests that you can do. You can find these at survivingmold.com, which test for a multitude of inflammatory mediators and hormonal measurements that, if they're in a particular pattern, suggest that you have this type of biotoxin illness. So once you have that suspicion, then you would test the home environment. It's called an ERMI test, or the work environment, and see if there's mold there. And that's a whole journey in and of itself. Once you've defined that there is an exposure, if you can, in an ideal situation, you remove the patient from the exposure. Sometimes you can't do that, as Dr. Carnahan shares with us, and you have to start treating. So how do you treat? Well, first of all, ideally, again, you get rid of the exposure. Number two is you're going to use binders to get rid of the toxins. That could be cholestyramine, that could be Welchol, that could be certain types of clays that help remove toxins. You might treat the sinuses looking for what's called MARCoNS, multiple antibiotic resistant coagulase negative Staph aureus, and the biofilm that it may create. And so you might treat the sinuses with certain types of antibiotic sprays, or sprays that might be more herb type sprays that help break up the biofilm, and also chelating agents like the EDTA. So you treat that area. And then you might treat also hormonal insufficiencies, and then also Dr. Carnahan treats the gut. So there's a stepwise fashion, but if you do these, what can happen is not only those cascade of symptoms improve, but in this particular case, neurologic function improves. And what's been shown by Dr. Bredesen is that certain Alzheimer's patients can improve as well. So I highly recommend that anybody that has any kind of cognitive disorder or early Alzheimer's or dementia, listen to this podcast. Listen to the stepwise fashion that Dr. Carnahan goes through, because she's just very detailed, very experienced, lots of clinical pearls. And at the bottom, you'll see resources. I have links to almost every single type of assessment and testing that she recommends, from stool exams to food intolerance testing, to the sinus testing, to the mold testing. So all the links are in the summary below the podcast. So my name is Kirk Hamilton. If you have anybody that has cognitive dysfunction or Alzheimer's disease, it might be worthwhile really listening to this podcast, and also going to the links to see if your loved one or you for that matter fit into this. And even if you didn't have cognitive decline, there's a lot of chronic symptoms that can improve by addressing a mold illness. So my name is Kirk Hamilton. This is the Staying Healthy Today show. Go to stayinghealthytoday.com. This will be up at YouTube, and this will be up on iTunes. Below this YouTube, there'll be links. I'll talk to you soon. You have a fabulous day.